you for being here. Chair, we are one shy of quorum. As soon as we have quorum, I'll let you know. And
Okay.
Danny, if you wouldn't mind letting us know if you're here as a proxy or here as a visitor, we would appreciate it. Hi, Danny, can you hear me? Danny M.
Yes, I can. And I'm sorry, I'm Daniel Murillo. I'm with the city of Peoria.
Wonderful, thank you. Are you here as a proxy?
I believe so. I'm hoping my council member joins. So that's all. I'll leave it at that for now.
No problem. We'll give it just another minute. Thank you.
Thank you much.
Hey, Amy,
Yes, sir.
can you send me the packet to mstewart@2completion.com? Unfortunately, I'm kicked out of my city email security or whatever.
Oh, sure.
And I can't get to it.
Okay, not a problem. We'll get that right over to you.
It's mstewart@2completion.com.
Perfect. Thank you.
Yeah.
We will send that over your way.
I appreciate it.
No worries. Thank you.
Chair, we're sending that over right now.
Thank you.
Okay. We do technically have quorum with Daniel representing for Councilmember Patena from Peoria. If you
Yes.
would start, or we can give it another minute and see if we have other members who will be joining us this morning. Chair, we are still one shy of quorum, but we are sending a reminder to membership at the moment. You are welcome to go ahead and get started if you'd like, and we will postpone the approval of the minutes until we have additional members.
You got it. Hey, did that file come over yet?
It did. We did send it on our end.
Interesting.
It is coming from Mimi Bustilla.
I'm sorry, where?
It's coming from Mimi Bustilla. She's a member of our staff.
Yeah.
All right, Chair, we need to wait just a minute, please, until we have quorum. We're going to send that. We're going to send that message out in just a moment.
Okay. Well, I'm good. We can, before we get quorum, we can just move into item number 4.
We actually have direction that we should wait till we have quorum to begin the meeting. So if you could please hold just a moment. My apologies.
Okay, we got one coming.
Yes, thank you.
You bet. I have the packet.
Hello, it's Amy. So before we start, Councilmember Stewart, I just wanted to thank you for presenting at the webinar earlier this week. It was fantastic. I really appreciate your time at that. And Vice Chair Duff, it was wonderful to have you there as well. Thank you very much for coming. I'm not sure if other committee members were able to join us for that, but it was just a great session and really appreciate your time at that.
Yeah, it was very good. Thank you.
Amy, frankly, that was an incredible symposium in the breakout rooms. I was only able to attend the one, but the discussion was phenomenal. And I think it really clarified some of the challenges that we're having. So thank you for pulling that together. And I think if we continue to elevate the conversation around the supply chain and the challenges we're having with zoning and moving permits quickly and getting more housing, we just need inventory as fast as we can get it. And I think that's been perfectly clear. And that symposium definitely drove home that point, as well as the other options, right, for housing. So thank you for doing that.
Oh, you are very welcome. I was really just grateful to be able to work with our partners to make that happen. And having you there showing your leadership in this space is just really critical. So really appreciate you. Thank you.
Thank you. Well, are we ready to get started?
We have one member who is joining right now through Zoom. She just requested the link again, and we need to wait for her to have quorum. So I apologize. It'll be just.
I'm just excited. I'm ready to go.
Thank you.
Hey, Kathy, how are you?
Hi, Mark. Doing great. Thanks. Just got to the cabin.
Oh, yeah, that's right. What, is it chilly?
It is. Well, it's in the 40s, so not too bad.
That's not too bad. It's almost balmy for up north.
It is. Still a little snow here and there.
Hi, Councilmember Condi. How are you?
I'm doing well, thank you.
Good.
How are
I'm
you?
so glad to see you. I'm doing great. I've been meaning to reach out to you on text, but I didn't have your cell phone number. Thanks for being at the Night of Hope. I was trying to find you to get you up on stage with us when we were there. You ducked out on us, or I don't know if you didn't duck out, but I was trying to find you. But did you have a good time?
We had a wonderful time. It was very
Yeah.
Inspiring and just gave us a lot of hope, because there's a lot of people wanting to make a difference in regards to human trafficking. And so it was just great to see so many people come together as one. Wonderful.
Yeah, I agree. I'd like to talk to you a little bit more about it offline. So maybe you could put your phone number in. Oh, you can't chat on this. I'll have my staff reach out to you and we'll get that
Sure.
cell phone. Awesome.
Chair, you now have quorum.
Oh, fantastic. Well, let's call this meeting to order, everybody. Amy, you want to take the roll? Or have you already done it?
Good morning, Chair and members of the Human Services Community Initiatives Committee. I'm happy to take roll. Councilmember Wally Campbell. Vice Mayor Ali Klein.
Yes, here. Sorry.
Councilmember Tina Condi.
Here.
Thank you. Vice Mayor Monica Dorsey.
I'm here.
Thank you. Supervisor Steve Gallardo. Councilmember Benny Janik. Councilmember Joel Navarro. Councilmember Bill Patena.
This proxy is here.
Rachel Sanders. Vice Mayor Kathy Tilkey.
Here.
Thank you. Vice Mayor Jen Duff.
Here.
Thank you. And Chair Mark Stewart.
I'm here. Thank you.
Thank you.
Well, let's get this kicked off. A couple of things that a little housekeeping I got to start out with here. For our call to the audience, an opportunity will be provided to members of the public to provide input, written comments, and Ag Services Initiatives Committee on items that are not on the agenda but jurisdiction of MAG. Members of the public who are attending the meeting in person are asked to fill out a comment card and provide it to MAG staff. Those attending virtually are provided the option of submitting written comments related to the meeting to the MAG website and indicate for which meeting the comment is intended. Comments may be sent at any time leading up to the meeting, but must be received at least 1 hour prior to the posted time for the meeting. Comments received prior to the deadline will be read aloud during the meeting. Comments must not exceed 3 minutes in length. A total of 15 minutes will be provided for the call audience agenda item. Unless the committee requests an exception to this limit, please note that the comments received or agenda items motion for action will be read at the time it's heard. Amy, do you have anything for us? Any calls to the audience?
Chair Stewart, this is Kelly. We have not received any comments on this item or any other comments on the agenda today. Thank you.
Kelly, thank you. Sorry. Okay, I'll take a motion to, has everybody had a chance to review the meetings minutes from last session? Assume that we have. I'll take a motion to approve the meetings from last minute, January 12th.
I'll move to approve.
Was that Councilmember Klein?
It was Councilmember Dorsey.
Councilmember Dorsey, and I need a second, please.
I'll second. This is Councilmember Condi.
Thank you very much. And voice vote to affirm?
Aye.
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 Okay, I have it. Meeting minutes are approved. Thank you very much, everyone. And now we'll move to item number 4, regional affordable housing efforts. So as mentioned, we had a great symposium earlier this week regarding affordable housing. We have a presentation today. So in December of 2021, the MAG Regional Council approved Pathways Home, the Regional Homelessness Action Plan for local and tribal governments. This plan included an action step to develop an affordable housing public education campaign. And hold on, please. At the direction of the Regional Council, extensive outreach and research have informed the development of the campaign materials. A presentation will be offered on the campaign name, visual identity, implementation plan, and partnership opportunity. In addition, MAG is partnering with Affordable Housing Collaborative under the Arizona Community Foundation. On the basis of input received from MAG member agencies and stakeholders, the collaborative will provide a quarterly webinar series and online resources. An update will be provided at the first webinar scheduled on March 7th, 2023, about the Vitalist Health Foundation report on promising housing practices. Peer learning network opportunities will be available through the local jurisdiction committee. Info will be invited on how this can be involved. Amy St. Peter, our Deputy Executive Director of MAG, and Kelly Taft, Communications Director of MAG, will present on this item. So without further ado, let's take it away. I love the logo already.
Thank you very much, Chair and members of the committee. This is St. Peter. Just want to check, are you all able to see the PowerPoint presentation with the logo and the name? You can see that well?
Yes.
Yes, excellent. Thank you so much. Really excited to be with you today. We've been talking with you about this campaign, of course, throughout its development. Really appreciate all of your feedback and are eager to continue the dialogue and particularly to be able to partner with you, to continue partnering with you as we prepare to launch a campaign at the end of this month. So as Chair Stewart had said, the idea of the affordable housing campaign comes from Pathways Home that was approved by you back in 2021. At the end of that year, in 2022, in April, we officially merged our efforts to develop a public education campaign on affordable housing with Home Matters to Arizona and all of their partners, with the idea that we didn't want to confuse a marketplace and we really wanted to use our resources wisely. And so it just makes sense to work together because we can do more by working together. Our last update to you was at the end of last year in 2022, and that's when we shared with you the marketing strategy for the campaign. And we're really eager today to share with you the logo and the name for the campaign and to really be able to offer you some current information about new developments in regard to launching the campaign. So if we can go to the next slide, please. Now, I think it's really important to start with why, because affordable housing can be a very emotionally charged issue. There's a lot of really good data around affordable housing, there's also a lot of misconceptions about affordable housing. So this is a picture of Claire. This is Claire and her daughter. They experienced homelessness in our region because they could not afford housing. So she's lived this story. And thankfully, she came out on the other side of it. She's standing in front of her home right now. And she was able to find housing for her and her family because she was able to receive assistance from a local nonprofit. Not everyone is as lucky as Claire. Not everyone has had her opportunities. And so we're conducting this campaign for people like Claire, our neighbors who are struggling to have a place to call home. And we're excited to be able to partner with you in this really important effort. If we can go to the next slide, please. It's also important to look at what are we trying to achieve through this campaign? And we're striving to cultivate champions in every community who can help to promote a more diverse housing portfolio in every community throughout the region. It's critically important that this work be grounded in the priorities, the preferences, the capacity, the ability of each community. So there is not one size that fits all in this. It very much needs to be locally driven. That being said, the campaign can be regionally coordinated. And so we'll be able to conduct the media buys, for example, on behalf of the region, with opportunities for every local community to really engage in a really robust way. Because ultimately, it really is about everyone having a home that meets their needs, and needs are defined very broadly. It's not just about money. It's about the ability to live close to the people and places that really matter to you. So your place of work, your place of worship, your extended family, friends, medical care, school, all of these are really important, and all of these really center around having a home. Next slide, please. So we're holding ourselves accountable with this campaign, and we're very much wanting to clearly articulate what we're achieving through this campaign. So as a result, we have both long-term goals and short-term goals. So you'll see the long-term goals in front of you on that screen now. The long-term goal is that we're reshaping the narrative around affordable housing. It's hard to promote something when you either can't talk about it, or when you talk about it, people have really different strong feelings about it. So for example, instead of referring to affordable housing in our materials, we'll be referring to this in a different way, such as affordable rents and mortgages. It's a lot harder to argue against affordable rents and mortgages when really everyone would like that. Whereas often when we talk about affordable housing, people have a very type in mind for a physical type of structure, and it's not always pleasing in their estimation. So we're reshaping that narrative and offering that new framing. We're also really building coalitions of support, keeping in mind that with coalitions, some partners can step in at certain times and lean in, while other partners might need to step back. But if we have a diverse coalition of support, we'll have somebody always able to help lead this discussion throughout the state. And ultimately, it is really about having a broader array of housing options available in every community at different price points, different ways of meeting people's needs, and fewer barriers to be able to attain that housing and to stabilize in that over the long term. Next slide, please. These short-term goals then will help us to achieve those long-term goals. And so what we've built right now is a really intentional framework. Kelly Taps will be talking in just a little bit about the toolkit. So you'll see the messaging and the tools are really related, because that framework is supported by the tools that we'll be able to offer to our audiences. And we do have 4 main audiences in mind. And one of those is elected officials and community leaders. So we're really hoping to be able to partner with you in your communities to support these regional efforts. It really is about cultivating more leaders, more champions like you. You were there at the webinar, you're here now in this committee, so you believe in this work. We need to find other people like you who can help to lead this effort as well. And again, leading it through coalitions as well as through individual people. At this point now in the presentation, I'd like to transfer over to Kelly Taft. She's our communication director for MAG, and she's been instrumental in helping to shape this campaign. We could go to the next slide, please. And then Kelly, the floor is yours.
Thank you, Chair Stewart, members of the committee. Among the progress that we have made since we last presented to you was the development and adoption of the final name and logo, which you've been seeing throughout this presentation. But I just wanted to take a step back and say, to get to this identity, we conducted extensive research and outreach to develop options that resonated with a lot of diverse stakeholders. We heard from you that the mark should embody the central message of the campaign and evoke positivity, and we think that has been achieved. We also held a higher legal standard for the name because we are asking you as our members and partners to broadly share it, and we wanted to minimize any risk. So for those of you who might have participated in the initial public input naming session, we had shared 3 names. Unfortunately, none of those names passed legal review. So Home is Where It All Starts was actually a great find because not only did it meet the criteria of the feedback that we had heard from you and really resonated with some of those key themes, but it was already trademarked by our partner, Home Matters to Arizona, which has been a core member of our team in developing the campaign. The visual identity includes a keyhole motif, which has rich meaning. It's the entrance, it's the start, it unlocks a new beginning, and it relates to the concept of the physical structure of a house or an apartment. We believe that the contoured lines provide a welcoming appeal. The colors are bright and joyful, getting to that positivity that we had identified as key. A very warm, welcoming palette. The interior is reflective of Arizona's beauty, highlighting our shared home, which is a really important key message for us. It means that we are being in this together and that we all have a stake in addressing the need for affordable rents and mortgages. So you can go to the next slide. Thank you. This is just an example of how the brand might be included on a piece of collateral along with the key messages, just kind of how it would look like in use. You can go ahead to the next slide. So with the help of a Cox integrated partnership that Amy will address again in a moment, but we've launched a website, homeiswhereitallstarts.org. So central to our core strategy is to tell the story of home on what is possible. Our intention is to populate the site with real success stories of people with lived experience. So we will start replacing some of the stock photos that you see on the website currently with some real stories of people here in Arizona with lived experience. You can change the slide. We're also completing a toolkit that should be available to you very soon that includes specific calls to action, ads, key messaging, and sample media posts along with the branding guidelines. Next slide. So we had a wonderful opportunity to kind of do a soft launch and roll out the campaign during last week's Arizona Housing Coalition conference. We had a graphic recorder who recorded discussions about the campaign in which we had participants sit down with her and talk to her about what having a home means to them individually, but also for the community. So we had sort of a one where you're looking into the keyhole and one that you're looking out of the keyhole. This particular final product is the one that was looking out of the keyhole and what having a home means for community. And you can just see just some of the key themes and how being connected to home means also being connected to the community and having a shared experience for all. So you can change the slide as I now turn it back over to Amy to discuss the next steps.
Thank you, Kelly. And this is Claire with the rest of her family. They are at home and they are stable because of the assistance that they've received. We want to make sure that more families like Claire's do have access to housing, and increasing support for affordable housing throughout the region, throughout the state is really critical to making that happen. So we had a soft launch, as Kelly had mentioned, at the coalition conference. Our hard launch, our full launch, will occur at the end of this month after regional council. We wanted to be sure to bring this back to you to have the benefit of any ideas or questions that you might have. But we're really excited to launch this campaign, and truly we cannot do it without you. So I'm really hoping to have your support with this. We're also very thankful to the partnership that we have with Cox. We're able to really leverage nicely the funds that we've raised, thanks to you, for those regional media buys. So for example, throughout the state, for the statewide campaign, we'll be paying Cox $150,000 through Home Matters to Arizona. We'll get at least $300,000 back in return in terms of their work. So they develop the website, they're developing other materials, they're also conducting media buys and promoting this campaign through all of their networks. So really excited for that. We're able to leverage that partnership because of Valley Leadership and the unique relationship that they have with Cox. So that is really good news. We will have regional funds remaining after we pay our portion of that Cox Integrated Partnership fee. And we'll be using that for very MAG-directed, member agency-directed media buys at that regional basis. So very much want to thank Virginia G. Piper Charitable Trust, the Town of Paradise Valley, Town of Fountain Hills, and City of Avondale. We are hoping for additional sponsorship of the regional campaign, because then that will enable us to make more directed media buys that are really directly in alignment with where you would want us to spend these funds. So if anyone has ideas for additional sponsorship opportunities, that would be fantastic. We'll be sharing the toolkit with you very soon, and hope that you'll be able to leverage the resources there, the social media posts, the web text, the different activities within there, as well as the calls to action. But we'll be promoting the campaign at least through the end of this calendar year. We already have plans to move into next calendar year as well, being able to evolve the campaign, take those lessons learned, and then apply them moving forward. If we can go to the next slide, please.
Kelly, hi, this is Chair Stewart.
Yes, Chair.
Hey, you had mentioned opportunities for sponsorship. Have we reached out to that home coalition that put on the symposium last week that was referenced earlier? And is there anything help coming from the governor's office on this?
We have not heard directly from the governor's office on this, and we've not reached out to the home coalition, although that's a great idea and certainly one that we can pursue.
Okay, if there's anything I can do to help, we'll take it offline. And I'll check.
Excellent. Thank you.
We can send a letter. Thank you.
Thank you. Really appreciate that. The ideas like that are very much needed and appreciated. So on your screen, you'll see the QR code. You can access all of our materials through that QR code, as well as through the website, homeiswhereitallstarts.org. You'll see the contact information for myself and for Kelly. Please do reach out to us. We'd love to be able to continue this conversation. The development of this campaign was significantly shaped by all of the outreach. And so you've been fantastic through this with providing your input. We've also leveraged the local jurisdiction committee through the Continuum of Care, as well as the Continuum of Care board and committee itself. And we've been working with your public information officers throughout this process, through public input sessions, different committee meetings and presentations such as this. So we do hope to continue this dialogue with you and look forward to being able to fully launch a campaign with your support. That does conclude our formal presentation, and we're available for any questions that you might have.
Thank you so much. And great presentation. And what does everybody think? Great logo. Just it explains everything, and the messaging is gonna hit home. No pun intended. Bad jokes. Bad dad jokes.
No, it's good.
Any questions, comments?
Chair, this is Councilmember Dorsey. This looks like a big step in the right direction and kind of the culmination of a lot of work. And I appreciate everything that Meg and all the folks have been doing on it. And I'll be anxious to take a look at everything that's coming out and seeing how some of the groups I'm connected with can make use of it. So thank you, everyone.
Thank you.
Thank you, Councilman. I have a quick question. Are you going to be distributing this out to the city's neighborhood services? That's what we call our services group. Will you be distributing that to for us, like Leah Powell? Will that be going out to her, or do you need us to do that?
Mr. Chairman and members of the committee, absolutely. We would love to share it far and wide. And so we'll be sending it to your staff. And if there's anyone in particular that you make sure receives it, please do let us know, and we'll make sure that they're on the list. But we'll be sending it out through this committee, our Human Services Technical Committee, and as well as through the intergovernmental staff that are employed by each of the tribal governments.
And I'm sure you've got an email list from this symposium we had earlier in the week. There's a lot of really good, trusted voices in that group that are private and public partnership groups. I don't know if it's appropriate, but maybe those are folks that.
Oh, absolutely. No, thank you. Great idea. We definitely want to cross-fertilize there.
Well, I want to be sensitive to everybody's time. Let's move on to item number 5, homelessness assets and needs data for unified planning. HandUp, great acronym. HandUp is a mapping tool developed through the partnership between Solari 211 Arizona and Maricopa Regional Continuum of Care and MAG. It displays services and programs that assist people in experiencing homelessness in Maricopa County region using data from the annual housing inventory count and the 211 Arizona Resource Directory. Katie Gentry, MAG's Human Services Manager, will give an overview of this item. Thank you, Katie.
Thank you, Chair Stewart and members of the committee. I am going to share my screen and walk you through this tool. It's really just a great tool that we've been using for about 1.5 years now. Really, when you open up this tool, and you're more than welcome to gain access to it if you need. I will tell you how to gain access to it as I walk through it as well. So when you get to this tool, the first thing you'll see is this pop-up. It will really tell you that this is not a public-facing tool. Rather, this is really a planning tool. So this is for you, your staff, people working in the field to really direct folks to resources rather than a client on the ground level to try to find resources. We really want to direct those folks back to using 211, and this is more for planning and resource development. Once you click on there, you'll see a brief overview of what the tool is and how we got this data on the top here. And then it is password protected. So if you need the password right down here on the bottom, you can click request access and our team will get back to you within 48 hours with the password to that. So as we log in, it'll populate this tool. So it will be a bunch of different data points. It'll take a second to load, and it will really shows the breadth and depth of resources tailored to people experiencing homelessness. So this is really all of the resources that we've identified throughout the region that are working to address homelessness. So on this right side, you'll see all of the different resources that you can toggle on and off. So for example, if you didn't want to see shelters, you could turn that off. Vice versa, if you only wanted to see shelters, you could toggle everything off and just those on. The other thing I'll highlight is on this left side, you can hit the plus button and it'll drop down the different types of shelters to say you only wanted to find medical respite centers, for example. You can click off all these other ones and just the medical respite shelters will come up. As you can see, we don't have very many of those in the Valley. The other thing that I'll highlight down here is you can also search by city and provider. And if you are interested and don't know of any of the terms located in these resources, there's a glossary right down here on the right side. This tool is updated twice per year. It is a pretty heavy lift to export all of the data from Solari and our partners at 211. And then we also subsidize it with our housing inventory count and resources here at MAG that we know about. The last thing that I will highlight is on this left panel, we have a series of map layers. This will really overlay on top of the resources some of the things that are happening in our community. The first things you'll see are census maps. So this is going to be straight from the 2015 to 2020 American ACS survey. So we continue to update that over time. And then so you can populate those on and off, and you'll see that the background will change on the map based off of those layers. So say you're looking for a very populated area to see if a resource is there, that's where you would use that type of map. The next group you're going to see is homelessness maps. So this is different layers that we've exported and laid in with other tools that we've used throughout our community. So the first one being our street outreach locations. So these are going to be folks where we contacted them throughout 2021. We'll be working to update that to where were folks contacted in 2022 in our next update come April. The second one you'll see is our PIT unsheltered data. So this is our 2022, where did we interact with people during our point in time count mapped across. So if I click that, you'll see high density versus lower density folks. The third one down is going to be self-reported based off of permanent address within our homeless management information system. And then we also have 211 calls based off of zip code specifically related to homelessness. The other one that I wanted to highlight is our at-risk. So this is populations that are being populated based off of calls into 211 for rental assistance or utility assistance, and then evictions by block group. So much more specific. And then based on those same timeframes of 2020, 21, and 22. And then the last thing I'll add is we have some additional layers. Most of these are coming from our census information, but you're able to click on zip codes, you're able to click on hospitals. You can overlay multiple of these at the same time if you're interested. And the one that just got added the most recently is self-reported outreach teams. So where are outreach teams working in our community specifically related to homelessness? So it tells you how many outreach teams are working in that space, and we're working to further update this to have some of that cross communication between our outreach teams in those locations. With that, the last thing I'll highlight is, if you have any feedback for us, we'd love to hear it. If you see this tool and you're like, hey, our program isn't on here, or I'm really interested in adding this or seeing this in a different way, feel free to drop that feedback and we'll work to get those things changed. Again, this is only as good as the resources we know about. So really trying to keep it as fresh as possible with the work being done. So with that, I will turn it back over to you, Chair Stewart, for any questions.
Thank you very much. Great presentation and great tool, without question. Any questions from the floor? Comments?
I have one, if I may, Chair.
Daniel?
Thank you, Chair. Yeah, amazing tool, Katie. I really think this is something that is beneficial for everybody across our departments, or I mean, across the organization. So my question to you, and I apologize if I missed it, but is there a limit on who can access this data? Because like I said, I can see everybody from our neighborhood services director to, you know, library front staff really being able to utilize this tool to help out in their day-to-day. So just curious who is able to get access and how do they do that?
Absolutely. Thanks, Chair Stewart, Member Murillo. It is really a planning tool, so happy to have any of your staff have access to it. On that front page, as you go back to it, on the login page, I will share my screen again. There is a request access button right here down at the bottom. So if folks drop request access, we'll ask them to put in their organization title, name, and email, and then we'll blast over that password to you to be able to get you access.
Very cool. Very easy. Thank you very much.
Any other questions or comments?
This is
Great.
Ally Klein. Sorry, Chair. Just
Councilmember
wanted to
Klein, go ahead.
my voice is a little foggy this afternoon, so just wanted to reiterate what Councilmember Murillo from Peoria said, that I think this would be something that we could use in our human services department and in some of our planning areas. So once we get the packet out, I'll be sharing that with them to make sure that they have access to it. So thank you. I think this was, I love maps and I love all this ability to go in and seek information and how it relates to our communities. So thank you for all the hard work that took to put that together. So thank you.
Of course, thank you.
Great input. Okay. Well, I think that takes us to item number 6, low income housing tax credit, LIHTC. It's something that's been around since 1986 as part of the Tax Reform Act passed by Congress. The LIHTC program is used to promote the development of affordable rental housing for low income individuals and families. To date, it has been the most successful rental housing production program in Arizona, creating thousands of residences with very affordable rents. The LIHTC, rather than a direct subsidy, encourages investment of private capital in the development of rental housing by providing a credit to offset an investor's federal income tax liability. Liz DaCosta, Housing Program Administrator with HCCCS, will discuss this item with us. Liz, are you ready to go?
Thank you so much. I just wanted to be clear that my discussion today is around the 1115 waiver. And it sounds like the introduction was around the low income housing tax credit. So
interesting. Katie or Kelly, since this was put out as an item on the agenda, but I think the public may have been misinformed, can we still move forward with the discussion topic?
We can, Chair. That was an error on my part. My apologies.
Okay. Liz, I'm excited to hear about this. So let's take it away.
thank you so much. And then we'll, Kelly, will someone be sharing the screen for the presentation? Excellent. Yeah, so glad to be here. So I'm Liz DaCosta. I serve Access right now, which is our Medicaid system, in the role as Housing Program Administrator. Really important as we all recognize this housing crisis that we're experiencing. that we all, work to try to contribute to address it. So I'm glad to be here today to talk to you a little bit about what Access is doing. We can go to the next slide. It's important to note too, though, we've been we have a really tremendous permanent supportive housing program in our state. And we've had it for quite some time through a $27 million state appropriation of general funds that comes to Access for us to be able to provide rental subsidies for members, primarily members with a serious mental illness, and then also a portion of individuals who are general mental health who have substance use issues or concerns. So through this, we provide rental subsidies for about 3,000 members per year. We can go next slide. Another really valuable tool we have is a state appropriation of $2 million towards our SMI Housing Trust Fund on an annual basis. With this, we're able to do property acquisition and renovation across the entire state of Arizona. And in exchange, we do CC&Rs. So it's the covenants, conditions, and restrictions for those units. And it requires that those property owners lease to members with a serious mental illness for a period of time, which right now is 25 years. So this is a really useful tool for being able to set aside dedicated units for a very vulnerable population. The other thing we do with that award, though, is we partner with our HUD Continuum of Care program in Maricopa County. So through those HUD Continuum of Care grants, oftentimes they need to apply for rental assistance and also support services in order to be able to meet the needs of the members. But by partnering with Medicaid on this project, they focus most of their dollars from HUD on the rental assistance. And then Medicaid comes in with our covered services to provide the support services. We also use some of our state appropriation to pay for things like incidentals. So if a member is not able to cover their full deposit, we would use dollars from our Access Housing program to be able to cover that. And that, in addition, adds another 1,500 members that we support. We can go next slide. These are some of the Medicaid covered services that we use to provide these supportive services. So case management, peer employment training, supportive employment. Those are all covered services where providers can submit claims to Medicaid to be reimbursed for those services. We tie those to housing tenancy support. So you can bill case management when you're helping a member secure IDs or documents, doing their housing search. You can also continue to encounter for those services as you help a member with stabilization. So when you're working with them on budgeting or helping them find employment, providers who are onboarded through Access can bill these services to cover the costs. We can go next slide. Through that, we've gotten really great outcomes. So we can see that in 2020, we served 2,472 members. We saw a 31% reduction in emergency department visits, a 44% decrease in inpatient admissions. Really important, a 92% reduction in the admissions of members to behavioral health residential facilities. So some of our more costly interventions. And so as a result, we had an average cost per member per month savings of about $5,500. We can go next slide. So what I'm here to talk to you about today is very exciting. It's actually our 1115 waiver expansion. So the Access team was going to CMS and requesting a waiver authority to be able to meet health-related social needs using Medicaid dollars. So really, we had that state appropriation of the $27 million prior. Through waiver authority, we're actually able to bring new dollars into our community from the federal government to be able to provide assistance with addressing health-related social needs. So the goals of our H2O program were to increase positive health and well-being outcomes for our target populations, reduce the cost of care for individuals who are successfully housed, and reduce homelessness and maintain housing stability. We can go next slide. So we received approval from CMS for this waiver authority actually in October. We have a lot of work to do still though before we're able to implement. So right now you can see where we're at as of today. We received the approval. CMS gave us some standard terms and conditions that we must comply with when we're trying to develop our implementation plan, which is what we're working on now. Once our implementation plan is due to CMS in April. So once we get the approval from CMS, then we're going to shift over into trying to develop rates, claiming protocols, determining our provider types, and updating access policy for how we're going to implement. Then we're going to do a lot of education and providing technical assistance with our managed care organizations, getting ready for go live. And then we're planning on this year, October, beginning to implement these services in our community. Really important as I go through the rest of the slides that we note that these are ideas that Access has and how we're going to do implementation, but we must get the approval from CMS when we submit that implementation plan to really be able to take the next steps. We can go next slide. So what are the services that we were approved for? We are actually the first state to get approved to pay for outreach services and include them as a Medicaid covered service, which is very exciting. We also were approved for transitional housing. We had asked for 18 months of being able to cover 18 months of transitional housing through Medicaid covered services under the H2O budget. We were approved for 6 months. So as we all know, with this housing crisis, we really want to take every single housing resource that we get into the community and try to be as creative as possible for using it to meet the needs of our members. So we're grateful for it, and we're going to go through how we're planning on trying to implement. We also were approved for one-time transition and moving costs, the ability to pay for home accessibility modifications and remediation, and then some additional support service dollars to pay for housing pre-tenancy and tenancy services. And I'll get into that a little bit more in a minute. We can go next slide. So I talked about how CMS gave us the frame in our standard terms and conditions for how we need to implement. So their criteria is that the members must meet one of each of the following. So they must be either homeless or at risk of homelessness, and they must also have some clinical or social risk criteria that they meet. So it could be that they have a serious mental illness, they're high cost, high needs, or there's chronic health conditions or comorbidities. So Access is working internally right now to really be able to determine who this eligible population will be using the framework that CMS provided us. What's really important is that this waiver authority is for a demonstration period of 5 years. And the goal is that we're able to demonstrate the effectiveness of adding these services so that we can continue on for years to come. So what we're going to really need to do in these first 5 years is focus it in on a very specific population of individuals who have the greatest need for health-related social interventions. That way we can demonstrate the effectiveness to be able to continue it on. We can go next slide. So once we've been able to identify the eligible population, these are the services and the ways in which we're planning on implementing. The first is the outreach and education. And so essentially what it would look like is throughout the entire state of Arizona, if a managed care organization or health plan has a member that meets our eligibility criteria, that managed care organization would be responsible for putting up dedicated targeted outreach teams at a 1 to 25 staff to member ratio to get out into the community, doing street outreach, engaging members where they're at, experiencing unsheltered homelessness often, and then their responsibility would be to complete the engagement, develop rapport, and then get them connected to our other services. There are a few other things that we want to make sure that we, implement through these provider qualifications. And one is that these outreach teams, even though they're funded through Medicaid, we want to require that they also participate in local continuum of care outreach collaboratives, that they participate in the local case conferencings that occur for coordinated entry. That way we're providing this streamlined connection with the COC funded resources and all the work that you all are doing at places like MAG to the Medicaid system. So we're essentially working together on a common goal. The other thing too is we're working with our clinical team to really roll out all of the different trainings that we're going to require these providers go through. Things like Healthcare for the Homeless 101, motivational interviewing, assertive engagement, a lot of the evidence-based practices that we know are effective when performing outreach. Right below the outreach and education, you can see we're able to pay for that transition and moving costs. We would award these dollars to our statewide housing administrator, which is currently ABC and Home Inc. So if they have eligible members that we're serving in that project, they could pay things like utility arrears, move-in assistance, deposits, things like that, that oftentimes members don't have access to and could prevent them from being able to move into stable housing. We can go to the next slide. One that we're really excited about too is, we got the approval to pay for transitional housing for up to 6 months. We want to try to set that up by paying for enhanced shelters. So establishing a per diem rate where if a member is residing in one of these locations called an enhanced shelter, while they're working on accessing their permanent housing goals, the provider would be able to bill Medicaid at that per diem rate for the duration of the member's stay while they're there. So this will help us bring some sustainable dollars towards providing the staffing patterns that are necessary for some of the shelters that have been put up. But what we would want to do is make sure that there's a standardization for how they're implementing these services. And that's why we've came up with a name of enhanced shelter. We would create a new license with ADHS. We would also create a new provider type at the Medicaid level so that we've got a lot of ways in which we're doing oversight of these locations. We would fund them with the ability to have a 1 to 25 staff to member ratio. So essentially the moment they come in those doors, they've got somebody on site who's trained and skilled to be able to help them access permanent housing, ready to meet with them rather than needing to wait. And they also would follow a harm reduction housing first approach. So that way, if there's members who are on things like medicated assisted treatment, they would not be denied from gaining entry into the shelter while they're accessing those services. We can go to the next slide. The other thing on the housing continuum is really important that, you know, we're not just focusing on being able to cover shelter services for stabilization, but also on rental assistance too. So we would work in partnership with our statewide housing administrator on being able to get these funds out the door. And that is where if we've got a member on an existing wait list who is coming to the top of the wait list, but is still waiting for a subsidy, we would be able to assist the member with moving into their own apartment, following our HQS standards and all of those additional requirements, to be able to lease up in their apartment as soon as 6 months earlier than if they were to have to wait for that subsidy. And then what would happen is once the subsidy becomes available, we would just transfer the fund source on the back end. So there wouldn't be much notice to the member. They would just essentially, they would be still living in their same apartment, drawing down on our H2O dollars for the first 6 months. As soon as a long-term subsidy becomes available, they would transfer that in the back end. We can go next slide. We also have that home accessibility modifications and remediation. So maybe there's a member with a disabling condition who needs some kind of a modification to the setting that they're living in to be able to stay there. We would be able to pay for those modifications. We can also do remediation. So oftentimes in housing, we see that sometimes there are biohazard conditions or pest issues. We would be able to have the fund source to be able to address those things through remediation. And then really important is this pre-tenancy and tenancy case management service. So I talked about those Medicaid covered services in the beginning and the ability for us to be able to have providers encounter those services to Medicaid, those claims to Medicaid to be reimbursed. But what we want to do with pre-tenancy and tenancy is really open up this service in a way where we have a brief assessment process, an easy way for providers to be able to submit claims, so that we're able to get more of these services out across the state in a streamlined fashion. With this, we would also require that they follow the SAMHSA's evidence-based practice for permanent supportive housing. They have low staff to member ratios, and we would be reimbursing them at a rate that allows them to get to the low staff to member ratios. That way we can really work to try to achieve the greatest outcome for very vulnerable populations. These pre-tenancy staff will also be required to go through a set of training modules as the H2O provider. We can go to the next slide. And so now we're going to chat about infrastructure. So we were also awarded funding. It's about $13 million annually for over the 5 years to be able to do infrastructure to help us set us up for success for this demonstration. We can go to the next slide. We participated in a lot of stakeholder sessions so far and received feedback from our community-based organizations that are not billing Medicaid services right now to try to design what's the best way for using our infrastructure dollars. So some of it will need to go towards outreach to be able to cover outreach of members who are not yet Medicaid enrolled. And then we've heard that there's a real need to be able to have technology assistance for community-based organizations to be onboarded as a Medicaid provider. So if we think there's providers in maybe your city or town that are currently performing really good, exceptional services, but we don't have any more resources for them to do expansion, by providing technical assistance for them to be able to become Medicaid providers, that would then open up their capacity to be able to draw down some of these resources to potentially do the expansion that we're looking for. The other thing is the activities to comply with our requirements. So if we're requiring all of these different training modules and evidence-based practice, we want to use some of our infrastructure dollars to help folks gain access to our learning management system, softwares, or Relia software, so they can attend these trainings virtually and we can track who's completed them. We will also be using some of the funds to cover some of our access staffing needs as we implement the demonstration. We can go next slide. And so next step, so we're continuing to receive stakeholder feedback to identify what is the best way that we can really try to meet community needs as we develop this implementation plan. Once we're done with that, we're going to submit our plans and protocol to CMS. And as I mentioned, that's due in April. When that comes back, as hopefully they say, you've thought through everything and this is approved, then we'll continue to hold other community sessions as we shift over into conversations around rates and reimbursement and invoicing processes. And then once that's complete, we're going to work with our members and health plans and the community to be able to implement the services over this next year, hopefully beginning in October. And that's the end of the presentation. We'll open it up for questions. Thank you so much again for having me.
Liz, thank you very much. That was extremely thorough and detailed. We appreciate it, but for a program like this, it needs to be able to understand, be clear on the effects. So thank you very much for that. So any comments or questions from the floor? I'm seeing none. That means a very thorough presentation. That's a good sign. So thank you very much. You know, that's a really, I mean, those three topics that we talked about today are extremely important for our community. And I think these continued meetings and symposiums and you know, meetings like this are definitely moving the ball down the field, and we're getting help to the people that need it most, and we're getting it done quickly. And so I'm really proud of the work that we're doing and what everybody's doing in their respective cities, and especially here at MAG. So thank you very much. We'll move on to item number 7, which is a request for future items. Do we have any ideas that kind of dovetail off some things we talked about today, or some new comments or ideas that might work within the framework of MAG in these meetings for our next meeting? Any ideas? Kelly, do you have any suggestions?
Oh, yes, Chair. We have a long list of agenda items for future meetings that we're more than happy to propose. And we are trying to do a better job this year of having the Human Services Technical Committee speak about the technical aspects of human service issues and then bringing you all the policy issues. And so we were really focused at the last Human Services Technical Committee on homelessness and the unsheltered community, which is why today's presentations were focused on that issue as well. And we are more to open up the future conversations about other human service issues that are of interest to you all.
That's great. Well, thank you very much. You know, one of the things I've really been interested in, and I know that this, and I'll speak for myself and maybe other council members feel it seems like there's a lot going on with the legislature and the governor's office that affect, I want to say funding, and that's every session. But it seems like more and more there seems to be some communication or some chatter about, you know, local funding and things like that. Are you feeling that at MAG, that do you think will be fully funded from the state? I know the federal dollars will still be there, but are you hearing anything from where we may need to lobby? I don't know if that's an agenda item, but are you hearing anything where council members and vice mayors we may need to lobby our respective legislators?
Chair Stewart, from MAG's perspective, we are a politically neutral organization, so we are keeping track of all of the different items that are moving through the legislature, and we're more than happy to organize speakers at your request on any of those, or an update on pieces of legislation going through.
Yeah, I just didn't know. I know there's some, you know, there's legislation going through, and at the city we're agnostic as well, right? So there's some things where the Arizona League of Cities is lobbying to protect local control and some issues and things like that. And I didn't know if there was anything from a MAG perspective that you would need our help communicating with our legislators to ensure that we're continuing to provide the services that we promised. But it was just a question, and it doesn't necessarily need to be up for an agenda item. It was just more of if we can be a resource for MAG and a lobbying perspective, we should definitely be doing that.
We very much appreciate that offer, Chair Stewart, and we would be more than happy at the next meeting to bring back a roundup of pieces of legislation that may be going through that may be of interest.
Okay, that'd be super. Thank you. Anything else from the floor? Any good ideas? Okay. Any comments from the committee? Anything going on in your neck of the woods that we should all know about, or any initiatives that you've taken on that you'd like to share with the committee?
Chair Stewart, I'd like to share about a project in Mesa that's been working very well for us. Can you hear me? Okay.
Vice Chair Duff, yes.
Okay.
Please.
It's with our police department. It's called a HOP project, Homeless Outreach Project. And they have been taking sections of our cities and neighborhoods, and they just do outreach to homeless that they see and finding out do they need a navigator? Do they need, what resources do they need? As well as they have events where they bring in resource providers like in a parking lot and then try to connect them with them in the areas they recognize as hotspots. So it's a way for them to get to know the homeless. Sometimes they may not accept a service or need anything and kind of like push away. But after repeated conversations, they'll open up and say, you know, I would like this or that. And it's been effective in being able to connect them to resources and hopefully lowering the emergency needs by identifying and seeing them as a person and seeing what they need. So I was just looking to see if they were in a position to ever present on that. I'm not sure, but I could consider that and talk to them. But it's been effective for us.
But that sounds like an incredible best practice that I think there's probably variations of that going on in different cities, but I'd sure love to hear more about it to see if we can mirror something in Chandler, especially if it's working. So maybe our staff can connect with you and maybe that's what we can talk about at our next meeting.
That'd be great. It's an addendum with our navigators. So it's just more people, more eyes on trying to get help to the people who need it. Thank you.
Super. Vice Mayor Tilke, did you have a comment?
I did. Thank you, Mr. Chair. First of all, hi, everybody. It's my first meeting. And so I know I have a lot of catching up to do. The first question I have is, are these meetings at 10 or at 1? Because I had it on my calendar from my staff at 1. And I just want to make sure I get them on the calendar regularly.
Thank you, Vice Mayor Tilke. These meetings are at 10 a.m. and we will be sending a series of meeting invites for you all to hold on your calendar in the next week to be able to block that time out.
Perfect, thanks. And I'll have them take that one, the other one off my calendar. The second thing is a request, just because this is my first meeting and I'm not familiar with the campaign. That was item number 4. If there's a list of objectives and goals for that campaign, would you mind sending it just so I can be brought up to speed on it?
We would be happy to. Thank you.
Okay, thanks so much. Appreciate it.
And welcome to the team, Kathy. And for those of you that have not met Kathy, she is extremely involved in the Gilbert community, and we're excited to have her on this board. You're going to bring a lot to the table. So thanks for being here.
Yeah. Thanks so much. Appreciate it.
You bet. All right, super. Well, that I think takes us to a motion for adjournment. 3 minutes past 11. Or do we want to keep going?
Oh, so moved.
All right, this meeting is adjourned. Thank you so much, everyone, for being here, and thanks for everything you do in your communities.
Thanks.
Yeah.
Bye-bye.
Everybody.
Yeah.